Hi Chandra, what is chiropractic?
So chiropractic is a form of manual therapy that works on the neuromusculoskeletal system. And essentially the way that it works is if you've got a joint somewhere that's dysfunctional, that will create imbalances in the way you move, and it will also create tension in the muscles that surround it. So you use hands-on techniques to try to free up the restrictions in the joints and cause the muscles to relax.
And what does it feel like to have it?
It's generally really comfortable. At Green Tree, we typically use very conservative techniques. So usually people are in a neutral position. We don't use a lot of twists because that puts a lot of tension into the muscles sometimes. So it might feel a little bit like somebody was poking you in the back or pushing on your hip, or maybe you would feel gentle rocking motions. Usually patients quite like it.
And what is that popping sound that you sometimes hear?
So the popping sound is called cavitation, and it's the release of a gas bubble. They used to think you had to have cavitation for a adjustment to be successful, but now they know that you can release it somewhere else in the body, and it doesn't actually have any real clinical importance. The McTimony technique doesn't typically cause it because some patients, they don't like it, so that's a better technique for them. But regardless of whether you hear it or not, clinically, it doesn't have any real meaning.
And how do you tell if it's working?
As chiropractors, we look at a lot of different outcome measures. So when you come in, we would look at your range of motion, we would look at your pain levels, we would check how tight the muscles are, and we would look to see how much your problem was impacting on your daily life. And every time you come in and after every treatment, we would reassess all of those aspects, monitoring for improvements along the way.
And why does it take more than one session?
Well, if you came to somebody on the day of injury, more than likely it would probably take just 1 to 2 sessions because your body hasn't had time to create compensation patterns. If somebody has had a problem for a long time though, as the joint is restricted, it involves the muscles that attach onto that joint, and then you change the way you move, which further involves other muscles. So in essence, what we're doing is not just retraining that particular joint, but we're retraining the entire body how to move properly.
Thank you.